Today we're going to cover the 3 steps to permanent relief for pelvic and SI joint pain. Now what is SI joint pain? So the SI joint, if you do have SI joint pain, is pain on either side of the tailbone where the tailbone connects to the pelvis. So this is a drawing of the pelvis. This is your tailbone. This is your lumbar spine or your lower back. The bones in your lower back called vertebrae sitting on top of your tailbone. And then on either side of that you have your right hip or your left hip if we're looking at a person from the front. So when we see somebody with SI joint pain, they'll typically have pain on that given side. 70% of the time it's on the right side. Don't ask me why that is, but 70% of the time we know it's on the right. You can also get shooting groin pain, buttocks pain, symptoms down the outside of the leg that's affected. So it might be pain, numbness, tingling, burning. Typically that person suffers from a heaviness as well. Can also cause some incontinence and leaking issues as along to affect sexual performance as well. Can be absolutely devastating if the pelvic problem is bad enough. Okay? Fortunately, most people just have pain on one side, so what can you do about it? That person who has SI joint problems typically has trouble rolling over in bed, getting in and out of a car, crossing one leg over the other. Usually they have trouble sitting for long periods of time, especially if it's on a couch or a soft surface. So it can be absolutely devastating. Now, what are the steps to permanent relief for that? Number 1 is this. Most people, when we see them, if they're going to try exercises on their own and they only have a little bit of SI joint or pelvic pain, they're doing stretches. And yes, there's a very basic stretch which most people show me on day 1, and it's a piriformis stretch, which is where you grab the knee and you pull it up and across to the opposite shoulder. It will give the person who suffers pelvic or SI joint problems and pain, it'll give them temporary relief. However, long term, we don't want to stretch. We want to strengthen or stabilize. And why is that? When somebody has an SI joint problem, so the center of gravity of your entire body is in the center of your pelvis, okay? And that needs to move the right way, and it needs to be stable when you're doing day-to-day activities. And if it's not stable enough, what will happen is the joint will move so far that it becomes stuck. So if we're looking at the tailbone, we have the tailbone and we have the pelvis, and you get a normal gliding day to day, if more stress, more force is put through the pelvis than the pelvis itself can handle, that SI joint can handle, what will happen is you actually become stuck. Now that creates all sorts of problems for the muscle around it, and what most people do is try to stretch their way out of it. The problem isn't stretching, or it's not flexibility, it's actually a stability issue. So if we want to stabilize, we need to do strengthening exercises. And if you go to on our YouTube channel, on the Madden PT official YouTube channel, there is a video called Top 3 Exercises for SI Joint and Pelvic Stability. And they're very low grade, kindergarten level exercises where you can at least begin stabilizing the muscles that control your pelvis. But we don't want to stretch, we want to think stabilize. Okay? Step number 2 is we want to take a look at our habits. All right? So what are some habits that lead to pelvic instability and problems? Number 1 is standing with the weight shifted. So if I'm standing like this with my weight shifted side to side for long periods of time, what that does is over years and years and years, it weakens the ligaments that hold. Ligaments are ligaments are tissue that hold joints together that we can't control. Okay, so like think about somebody with an ankle sprain. They sprained a ligament. They stretched the ligament, but it's not a muscle. It's different than a muscle. Okay, but there are little habits that we do. So if I stand like this, and like let's say I weigh I don't know 175 pounds, and if I'm standing like this, I have 150 pounds on one side, 25 on the other. Where if I'm standing balanced, I have 87.5 pounds on each leg. Okay, really quick math there, but so we want to take a look at our habits. Other habits that cause problems are sitting on a couch or laying on a couch in an awkward position or a side-lying position. The way that we sleep, if you sleep on your stomach and you have one leg raised higher than the other as you're sleeping on your stomach, that can cause problems. The crossing one leg over another, whether it's at the ankle or whether it's at the knee for long periods of time, that can cause problems. Sitting on one leg, which I know especially for office workers, a lot of women will sit on one leg as they're working. Well, if you work 8 hours a day, and let's say you do it half the time, so that's 4 hours a day, and there's 5 work days in a week, so 20 hours a week, and there's 50 work weeks in a year with your 2 weeks of vacation. That's 1,000 hours that you've spent stretching the ligaments in your pelvis. That can create very big problems. Also common amongst women is pregnancy. You know, when the woman gets ready for delivery, whether it's a natural delivery or C-section, there's a baby that's going to pass through the birth canal and the pelvis, which is right there. The body releases hormones, okay, called relaxin, that make those ligaments really, really lax. You know, not such a big deal at one pregnancy, but can be a really big deal with the second, third, or more pregnancies, because when that woman delivers, typically she has now a toddler at home to take care of, who she's carrying and lifting and holding off to one side. So that creates uneven wear and tear within the pelvis. That can lead to long-term problems. And I mean 30, 40, 50 years down the road can create problems there. Also common amongst women is shaving. So if the woman, which we'll see often with pelvic pain, if she holds one leg up and leans forward as she's shaving her leg, that can typically create problems. Create some pelvic pain and SI joints as well. So we want to take a look at the habits. The biggest violator for men is they'll tend to sit on a wallet on one side. So if they're like a heavy machine operator or a truck driver, or do something where they're sitting for 1 or 2 hour drive between jobs, and they have a wallet that they're sitting on regardless of how thick it is, that can create some pelvic and SI joint problems as well. So you want to take a look at that. And the third thing that we're going to address is this: what does successful treatment look like, and what can you do about it? So successful treatment for SI joint and pelvic pain is this: it's hands-on PT. So the very first thing when I see somebody in the clinic and they have SI joint or pelvic pain is their pelvis isn't moving the way that it's supposed to. Very difficult for me to unlock that, or for me to get their pelvis to move the right way without doing some sort of hands-on treatment. Okay, so hands-on treatment is the first component to move the pelvis in the way that it's supposed to. And the second component of that is to do exercises, as we covered up here, that strengthen and stabilize the pelvis and SI joints, so this injury isn't constantly happening to them over and over and over again. Okay, so we have hands-on PT plus strengthening exercises. And the relief can be quite quick with SI joint pain. Many times we'll have like those little miracle cures where somebody comes in and the same day they walk out leaving 50 to 75% better, and we just need to strengthen them from there on out, and they do really, really well with physical therapy. Now, if you're not in central Pennsylvania, how do you find a good hands-on physical therapist? And this is the answer that I give for the inquiries, the questions that we get all over the world to how to do this. So whether you're in Australia, whether you're in Ireland, whether you're in India or Canada or the Western United States, here's what we say: find the best hands-on PT in your area. Here's how to do it. Call in to schedule an appointment. When you do, ask, does the therapist do a grade 5 lumbopelvic mobilization? If they don't, or if there's stutter or hesitation, just call the next therapy office and keep moving. You want to find one who does the good hands-on PT. Now, statistically, about 1 in 10 physical therapists, or worldwide 1 in 10 physiotherapists, will do the type of hands-on PT that's necessary and that the research shows is the most successful for SI joint and pelvic pain. Also, another bonus item you're going to want to look for is keep an eye on your inbox, and over the next 3 days, 4 days, you're going to get an offer for a free report on SI joint and pelvic pain. We, particularly at our clinic, have done a lot of research here, and this is something that we specialize in, and frankly, I think we're pretty good at treating and helping people with pelvic pain. So watch for the offer for the free report.